Welcome to our multimedia presentation in our global health perspectives class. My name's Mitch.
My name's Damon.
And our topic is safe drinking water. So firstly, we're going to try and define safe drinking water.
So the first definition of safe drinking water is an improved drinking water source is defined as a drinking water source or delivery point that, by nature of its construction and design, is likely to protect the water source from outside contamination, in particular from fecal matter, and that was from Dar and Can in 2011.
Bain et al. Stated that the water was categorised as either being from an improved or an unimproved source. The improved source sort of goes to any water that sort of is from a safe location, whereas the unimproved source is sort of open water that is accessed by many people and can potentially have diseases and whatnot.
The UNICEF definition is an improved drinking water source is defined as one that, by nature of its construction or through active intervention, is protected from outside contamination, in particular from contamination with fecal matter. That came from the World Health Organization.
Very similar to the first one we had. I think they were either along the same lines or from the same people, but yeah, very similar in that.
So now we're going to focus on the groups that are affected by safe water that's affected by diseases. So from the World Health Organization, we found that Africa, Latin America, and large parts of Asia and the Caribbean have really poor access to quality water.
I'm also going to cover some of the diseases and prevalence. As you can see, the dark blue indicates death between 500 million and more than that, 150 million deaths. So majority is in Africa, some Indian countries, majority of third world countries that lack infrastructure and the ability to have better sources of water and better ways to sort of combat the issue of unsafe drinking water. You can see in Australia we're pretty safe. Parts of America are quite safe. North America, that is, Canada, doing quite well. This was taken from the World Health Organization's 2002 report.
Now we're going to focus on some diseases that are caused from drinking water that's contaminated or unsafe to drink. So we're going to focus on diarrhea, which is defined as the frequent passing of loose watery feces resulting in uncomfortable bowel movements.
And hepatitis, which hepatitis means the inflammation, swelling and pain of the liver. We're going to mainly focus on hepatitis A and hepatitis E. Both these were taken from the Department of Health and Human Services.
So firstly, we've got diarrhea. So acute diarrhea is the sudden onset of 3 or more loose stools per day that lasts less than 14 days. The most common cause of acute diarrhea is an infection of the intestines, such as food poisoning. Viruses are responsible for most cases, and the issue is normally self-limiting and will resolve naturally after 1 or 2 days. During acute diarrhea, intestinal lining becomes irritated and inflamed, which hinders the absorption of water from food waste. In severe cases, the intestinal lining wall may become weak and even leak water. Chronic diarrhea is defined as something that can last 4 weeks or is more commonly caused by a range of conditions that affect the intestines, including inflammatory bowel disease. Some symptoms of diarrhea, so abdominal cramps, abdominal pains, urgency to go to the toilet, and frequent passing of feces. So the more serious outcomes are generally based around the third world countries such as Africa, where death is a possibility from diarrhea. So you can achieve some pretty bad kidney failure and heart failure, and even fever and blood in the feces. Causes are from tropical diseases such as typhoid, but the main reason is infectious agents such as bacteria or virus. Viruses found in contaminated water or stagnant water. Children are heavily affected by diarrhea, and also it affects babies. This is due to their smaller bodies being vulnerable to dehydration, and the developing ability of their immune system to fight the infection, which is generally not as strong as an adult. This is a major problem in third world countries who don't have access to medical supplies and facilities to care for ill children, which leads to diarrhea, sadly, accounting for large death rates in areas like Africa. Around 88% of diarrhea-related deaths are due to unsafe water and inaccurate sanitation and hygiene.
So looking at hepatitis again, hepatitis means the inflammation, swelling and pain of the liver. Hepatitis A, anyone can be infected if they come in direct contact with hepatitis A through food, drinks or objects contaminated by the feces of an infected person. Symptoms may last several weeks, but the person usually recovers. Infection with hepatitis A will give lifelong immunity. However, this doesn't offer immunity against the other types of hepatitis. A vaccine is available to protect against hepatitis A. Hepatitis E is the most common in developing countries. There is no chronic long-term infection associated with the virus. Hepatitis E is more severe among pregnant women, especially in the third trimester. Hepatitis E virus is found in the feces of infected people and animals and is spread by eating or drinking contaminated food or water. Transmission from person to person occurs less commonly than with the hepatitis A virus. So some prevalence. The World Health Organization states that whilst our Millennium Goal was met, the target, 48 countries still weren't at their desired level, meaning that whilst we got the overall mark, it's probably leaving too much to too few, and there's a few countries that aren't really pulling their weight in that one.
So 842,000 people estimated die each year from diseases related to water. 361,000 children aged under 5 each year could be avoided. So that's saying that, you know, most of the deaths that occur are virtually things that can be prevented due to, you know, infrastructure, education, and knowledge about the dangers of unsafe water.
So there's a company that has developed a life straw. We're just going to play a little video that tells you a little bit more about that.
It seems like every day we hear about a business hurting people, so here's a different story. It's about a Danish man whose business is to help some of those in greatest need. Mikkel Vestergaard is building simple high-tech devices to help sub-Saharan Africa battle killer diseases. There's a powerful weapon against Africa's killer diseases. It's called prevention. A simple bed net can reduce malaria deaths in half, like Permanet, a high-tech mosquito-proof net which offers protection at night when the infected mosquitoes are at their peak activity. Or LifeStraw, a water filter worn around the neck, a lifesaver against Africa's killer waterborne diseases like diarrhea and guinea worm. These are just two life-saving devices invented by a Danish company whose sole focus is high-tech preventative solutions for the world's poorest.
Guinea-worm eradication is a very simple water filter, and that was also what inspired us to develop the LifeStraw.
The CEO of Vestergaard Fransen runs a for-profit business, but his bonuses are measured in human lives saved in the world's most underserved communities.
If you look at the health sector, about 90% of all health investments benefit only the 10% wealthiest on the planet, whereas only 10% of all health investments benefit the other 90%, and that represents a major gap in global disparity.
Vestergaard's customers live in extreme conditions, so the products have to be tough, inexpensive, work without electricity, need no spare parts or maintenance, and work for years. Some life-saving products have to be social stigma-proof as well. In many African rural communities, people are afraid to even ask for an AIDS test because of the stigma attached to the disease. But when people get tested, they get life-saving treatment and save others from getting infected. So Vestergaard launched a campaign with an incentive for getting an AIDS test. A free bag, packing a triple punch against Africa's killer diseases.
What we did was to offer a free mosquito net and a free water filter to everybody who came in from this district in Western Kenya to take an HIV test and receive HIV counseling and education.
Vestergaard's.
So as you can see, they sort of aim it at a bit of prevention compared to other sort of initiatives that sort of might target the end result instead. So really, if every person in Africa can have access to this life straw, it's going to prevent a lot of these waterborne diseases and the issues that come with that.
So now we're going to focus on sort of our thoughts about the situation, how we can create a better, sustainable, safe water. So governments and ministers of healthcare, they can provide vaccinations against waterborne diseases, invest in safe drinking water, hygiene and sanitation infrastructure, such as tanks, monitor progress and needs through the collection, analysis and reporting of water quality data, support clear and targeted health promotion and behaviour change programs. Non-government and aid organisations can increase the adoption of proven measures against diarrhoea, such as oral therapy, household and community systems for treating and storing water. They can educate communities on the importance of safe water, sanitation and hygiene. They can ensure the stability of safe water interventions and focus on the provision of safe water, sanitation and hygiene when responding to emergency and conflict situations.
Healthcare providers and clinical facilities can ensure that the availability of adequate medical supplies are met, ensure facilities for provision of safe water and proper disposal of human waste, meet demand for health workers, support the community health workers, improve training programs, and build more tanks and water storage devices in the communities that need them. And like the life straw, seek creative ways to motivate them and have different things in place to sort of help with that. Communities can support and promote the importance of community health, ensure water is safe and provided close to people's homes, discourage open defecation, construct basic sanitation facilities, and promote water saving and protection.
So now we're going to focus on the Millennium Development Goal number 7, which was to ensure environmental sustainability. So now that's finished now, and the review stated that they did achieve the goal of half of the proportion of people now have safe drinking water. So this goal estimated after the review that 89% now have access to safe drinking water, but there's still the issue of 11% not having access, which is being over 7 million people that have access that have just been counted on the data. So this data includes many countries in Africa, Latin America, large parts of Asia, and the Caribbean.
More needs to be done to help improve the water supply so that we can see improvements in all human development and health around the world. Focus must be making it more on the human right to access fresh water without the burden of disease. Education is key. Once again, more wealthy countries must help and chip in and support the lower third world communities and countries that are affected by this. We must come together as a whole nation and work to achieve the Sustainable Development Goal. Number 6, ensure access to water and sanitation. Thanks for listening to our presentation. We will go through our references.
Thank you.